And so when you see people who are violent or having outbursts, and you see people who are even arrested or in mugshots, and they're painted as these violent, horrible people, and the comments that are being said by the people that know them, like, I can't imagine, like, this is not them, X, Y, and Z. Instead of labeling them as, violent or horrible or a menace or a slack, or just all the negative things, I would like for people to have the knowledge to consider maybe something's happening with their brain.
Hello and welcome to another episode of Life, Language, and Lyrics with Laina. And I am really excited today because I have a very special person here with me to have some great conversation. I'm going to be introducing to you all Dr. Kelli Uitenham, who is a nationally certified speech language pathologist, which is how we met, an esteemed public speaker. She owns Serenity Speech Therapy, which is a private telepractice, and Kensington Academy, which is a consulting firm, and it's serving clients and caregivers. She also is the founder of the Brain Talk Foundation, which is a nonprofit that raises awareness about neurological and neurodegenerative brain conditions. Dr. Kelli has over a decade of experience and specializes in working with adults and seniors and focuses on dementia, stroke rehabilitation, dysphagia, Parkinson's disease, fluency disorders, voice disorders, gender affirming voice services, and accent modification. That's a lot. And her extensive career also includes working in skilled nursing, assisted living, independent living, home health, hospital settings, and as a traveling speech language pathologist. She's also licensed in 9 different states. That kind of blew my mind when I saw that, and offers telehealth services in each. She also works as an adjunct professor at Shaw University in North Carolina, at North Carolina A&T and St. John University. And she also is a clinical instructor for Purdue. So you are very, very busy.
Yes.
And in addition to that, she also enjoys fun things like riding motorcycles, traveling, and spending time with her teacup Yorkie Braxton. Welcome.
Thank you.
I just ran down a lot of your professional aspects, but can you tell us a little bit just about you, where you're from, who you are, all those kind of things?
Of course. That was a lot. You did really great reading all that down. But I am just a gal who is from Cleveland, Ohio. I was born there and lived there till I was maybe 7 or 8. And then I ended up moving to Charlotte, North Carolina, which is where I still am. But I've lived in other states doing other work, modeling work, travel therapy work. And Charlotte has just always been kind of that nucleus for me. And so I've always come back here. This is where I set my roots. But I do go home to Cleveland and see family. But Charlotte is where I live to this day.
Okay, Charlotte is a beautiful city.
Yes, it is, and growing.
Times. I've seen that.
Yes.
So we already kind of went through your bio and talked about that you're a speech language pathologist and you do quite a bit within that. Can you give some more specifics on maybe some of your day-to-day and just some of the different things that you do within the profession?
Sure. So day to day, a lot of my time is with my clients that I see through my private practice. So a lot of my time is spent in this very office. I see clients during the day. I will take meetings or consultations with potential clients before I see my clients during the day. And then in between there, I will have other meetings. So I do a lot of volunteer work. So I like to volunteer for ASHA, which is our national association. And so I'll do things like this year I'm one of the co-chairs for the adult swallowing normal and disorder topic for ASHA. I've also signed on to become a site visitor, and all of those things just feed into the field, but it is part of what I do on my day-to-day.
Okay. And then what about outside of speech pathology. You're
All
out
that
there
stuff you heard, look
riding
outside.
motorcycles?
Okay, yeah, motorcycles. That's like my freedom. It's like flying.
Yeah.
Which I like flying, so I have jumped out of a plane a time or two. But adrenaline sports, those keep me busy. So motorcycle riding, absolutely. I do like whitewater rafting. I like rock climbing, horseback riding, just anything that's going to get the blood flowing, I suppose. Jumping out of a plane definitely does that for me.
Oh, well, I could imagine that.
Blood's definitely going then.
Yeah, I do like horseback riding. I've never driven a motorcycle, but I've ridden. My dad used to race motorcycles
Ooh,
when I
drag
was
race?
younger. He drag raced. Yeah.
Ooh.
Yeah, he was pretty good too.
I'd love to talk to him about that. That sounds fun.
Yes. And then I've also seen you snorkel
Yeah.
too.
I'm
Okay.
a certified scuba diver. I scuba dive
Scuba
as
dive.
well.
Okay.
Yes, yes. So when I do my traveling, that's just something fun to do. It's also very peaceful, underwater, seeing all of the life that goes on. Like we're on land living and the hustle and bustle and stress and all of that, but to be underwater and just see this majestic world, it's a
Mhm.
beautiful, beautiful escape.
Yeah, I could imagine. I used to do a little snorkeling, but I've never done scuba diving.
Oh, it's beautiful.
Mm.
I recommend. I recommend.
Let's dig a little more into what you do in the profession because you
Okay.
obviously have some strong passions there, right? Can you tell us about what you're really passionate about in that area?
Yes. So I am passionate about adults. In the
Mhm.
speech world, it's peds, adults, and then there are the other niche areas, but those are the two big areas in the field. And I am very passionate about adults. I am very passionate about things that happen with the brain, hence my
Mhm.
foundation, Brain Talk Foundation. So
Yeah.
I do a lot of work with patients who have dementia, Parkinson's disease. Now I'm seeing a big uptick in long COVID brain fog. And so I'm getting very passionate about that. I've done some presentations on it. I've taken clients on, and it is a debilitating condition. And unfortunately, the media is very much, oh, it's a little memory issue, and then, you recover. But I think more light should be shed on that. And then the big push, my big passion is
Mhm.
working on concussion, traumatic brain injury, and CTE in athletes, military personnel, and then raising awareness about the role of SLPs and that we are here to help. I hear a lot of people, athletes that I work with, parents that I work with who have said, I wish I would have known. That's the one thing that
Mhm.
I'm always hearing. I wish I would have known, which means the knowledge is not readily available or being
Mhm.
pushed or stressed. I wish I would have known. And then I also hear like, and there was nobody to help.
Yeah.
So if physicians are not informed about us, then they're not referring to us, or at least not on a
Mhm.
large scale. We're still hearing that, stay off your devices, rest, and then return to play in 5 days. Like so much more needs to be said and done around that. So as you can see, I am very passionate about this topic.
Yeah, yeah. I'm gonna step back just a little bit to the COVID long haulers because I
Yes.
know we talk about it a lot in the neuro part of the profession, but I also don't think a lot of people outside of that really know what that means or what that looks like. Can
Right.
you kind of describe what you see or what you're seeing with this pop?
Yes. So this population is really anybody who has had COVID and is experiencing symptoms past when they would have no longer been contagious or would have deemed to have gotten better. So that could mean a number of things of different symptoms from the level of fatigue to the different, there's a very, very, very bad headache. They call it the COVID headache
Mm-hmm.
that comes with it, memory issues, word finding issues, but there are issues that are not even present on current batteries to assess. So things with vision. I have a client who no longer can type the way that she used to. Even sequencing and problem solving safety things. This particular client has a difficult time remembering to bathe. So sometimes it can be over a week, but the only way that this client is able to tell is if they look at their hamper and they see that the clothing is overflown and, there are no towels in the bathroom. So
Yeah.
could they have cleaned themselves? So many of these issues and symptoms are actually occurring in people. This particular client actually told me that she is a part of a Facebook group that has over 3,000 members.
Mm.
All of them have just as debilitating conditions as she does. And she says, they serve as a support for each other. But she said that there are a lot of people who have said, like, I've just given up. I've just realized this is my life. A lot of them can no longer work
Yeah.
because if you have a difficult time with sequencing, we take that for granted. The brain is a beautiful thing. We take that sequencing for granted. If someone is saying, hey, can you run down the hall, grab me some water, come on back, and then we're going to start this meeting. That's a lot of steps. And they may have lost you when you say, can you run down the hall?
Yeah.
They miss the grabbing, they miss the comeback,
Yeah.
and even where to come back. Are they going to remember that? So that is a little bit about long COVID brain fog, but there's so much more to learn about it and
Yeah.
a lot of awareness that needs to be raised about this too. So we are working
Yeah.
on that at Brain Talk as well.
Wow, that's really interesting though. I haven't worked clinically since COVID first happened. So I was doing PRN in like March to May. And it just started to get a little too scary. And then I had some
Mhm.
family things that happened, so I had to stop. But I haven't been clinical in that sense since then. So I haven't seen that. And it sounds really debilitating
It
as
is.
well. Wow.
Yes.
Um, and then we can shimmy back over to concussion because that's
Okay.
both of our passions, right? So we just really got to connect back in April and just really talk about concussion and what's going on and how people don't know as much. And you have the Brain Talk Foundation, which I know you address a lot of different issues, but what are some of your initiatives that are focused towards concussion?
So I always say, like, just give me a mic and an audience who needs this information.
Yeah.
So that is really the main goal right now,
Mm-hmm.
is to find the audiences that need to hear this information. So right now, the initiative that I'm working on with my team is we are working on going to different elementary schools, different middle schools, high schools, and letting the students, the athletes, I want coaches to know this information. I want teachers to know this information. I want referees to know this information. They're the ones who actually get to hear the impact on the field, seeing and hearing. So their experience and information, I'm going to get nerdy, their data can help even in, conferring and speaking with the coach and knowing what language to say, even, knowing, they don't have to get as technical and into it as we do, but to know that, okay, he took a hit here, perhaps keep an eye out on his decision making or, his emotional response or impulse control, that sort of a thing. But I think the big thing is this raising awareness and going out into the community and spreading the information. And I am also working on a book called 25,000 Mark. And thank you. And this is a book that is going to try and do raise awareness to some degree. I mean, I give 90-minute talks on this information, which still isn't enough, but to try to get it into a book. So hopefully people can just have something to take with them and use as a guide and a resource for when they are having to navigate this.
Yeah, that's really good. And I think that's such a great initiative too, because especially when we think about the schools, the kids, especially in elementary, because they don't play attached to the school. They play out in the community. So then when they come back to school, there's this huge disconnect because there's not really a bridge that's happening. And so the teachers don't know why this kid has made some changes. The parents might not understand, and the kid is not probably not understanding what's going on. So I think that's really beautiful that you're making that effort to like go through the K through 12 aspects, because they do need that information, especially as so young.
Yes, yes.
Yeah, yeah. I got a little nephew that just started. Well, he's been playing flag, but he's really wanting to do tackle. He's only 8. And I'm like, but he just had his, well, by the time this airs, he will have already played, but he just had his first tackle practice. And I'm like,
Oh,
his
well,
mama,
at
she
least he has you on his
I
team.
know. I said, well, I will be doing baselining, just so you know.
Yes,
And she was like, I need to get a helmet. I'm like, and a good one. I will contribute.
yes, good helmet. And just teaching them how to do the hits in a safe way, like,
Yeah,
using pads versus the helmet.
exactly.
Yeah.
Exactly. And
And then
I
making sure the
do.
coaches are educated for that too.
Yeah, and that's what I wonder about, because I know at the higher level, like high school, college level, they are making more efforts to teach them better form. But I'm wondering about that with the little ones. If those coaches who are, mostly volunteers, if they also have that same information. So you got a big task.
I do. I really do. Yes. But
Well, look, I'll say we, right? Like I'm
we have a big task, but I'm glad that there are people like yourself who are just as passionate, because we need more of us. We can't do it all by ourselves, but this
yeah.
passion is in us for a reason. And so
Yeah.
just doing what I'm called to do.
Yeah. And then I'm kind of gonna
Let's hop around.
I'm gonna kind of go around some of the disorders, because a lot of these I think we don't really get to talk about as much. I think people are more familiar with stroke, but
Mhm.
they're still not always that clear on what might happen after a stroke, right? Um, can you talk a little bit about that, and maybe even, look, I'm gonna go into my teacher mode. Maybe it'll be like the difference with like left and right, because I think that especially when a person has a right hemisphere stroke, they get really like, people are like, yeah, no, they seem okay.
Yes, yes. I primarily work with left side, or at least that's what I have in my practice. I do have experience
Okay.
with right, but I would like to just say the lack of awareness of how we are involved in stroke. It
Hmm.
is. I try not to take it personal, where it's like, ah. But when you have someone who's in your circle, a friend, a colleague, or something, and they're like, oh yeah, like, such and such had a stroke. And I think I say, like, why didn't you tell me? And they're like, why would I tell you? You're like, what? Do you not listen to me? So raising awareness for that tip alone is important. But with side effects of a stroke, there are many. So
Hmm.
a big one that a lot of people don't pay attention to is the swallow. So
Yeah.
I a study, I mean, I saw this study years ago, but the number I saw was 86%. There was an 86% um, chance, or 86% of people who do suffer a stroke do have some sort of, or some form of dementia.
Hmm.
Not dementia,
That's what I
dysphagia.
was gonna say.
Um, 86% of people who suffer a stroke, 86% of them do end up with dysphagia,
Yeah.
some form of it. So this is a complication or difficulty with swallowing. So anytime that food has entered the mouth, any form of chewing, and then that whole process of swallowing, which actually is quite complicated. We take that for
Hmm.
granted, but it is a complicated mechanism, that are a complicated action that our body does. And when an injury like a stroke takes place, the wires can get mixed up, damaged, injured, and that causes an issue. And
Hmm.
for left side, I deal with a lot of expressive aphasia, receptive aphasia, or both. So global aphasia,
Hmm.
um, praxia, um, dysarthria. So there are a lot of different things that um, end up getting affected by a stroke, even going to your vision. So you could have right side neglect, or
Hmm.
sometimes left side neglect. And I'm just working through those different strategies. A lot of what I do is providing education to clients, because unfortunately, when they're in those hospital settings, if they don't have a medical professional who is taking that time to give them that detailed explanation of what is happening to them, what this means. Then
Mhm.
a lot of times they get shipped out, they get discharged, sent home, and it's like they've got all this stuff and all these pamphlets and all these knickknacks, but they don't know what to do with them. And
Right.
so I feel very fortunate when those clients find me, and then I'm
Mhm.
able to share the information. But it's really like it blows my mind of when I will ask them something and they'll say, "Oh yeah, I don't know what that is," or "They didn't tell me about that."
Yeah.
I have a client who did suffer a stroke,
Mhm.
and they had an EMST 150. Do you know, you're familiar with the EMST?
Yes, with the muscle strength.
Yes.
Yes.
I don't show a prop. I don't
Oh,
know if
you got one right there.
you care, but this is okay to share.
Yeah, that's fine.
Okay. So one of these, this is the 150. There is another one that's the 75, but they gave this client the 150 and he was not ready for a 150. They also didn't tell him how to use it, what it was for. They just gave it to him.
Mm.
So when I brought that up as part of the treatment plan for strengthening his muscles for swallowing and for speech, they were like, "Oh yeah, we have one of those." So they had to order the 75, and now he's upgraded to the 150 after
Oh,
the
good.
exercises that he's done. But it was just mind-boggling that nobody
Yeah.
told him. They just gave it to him, and he had
Yeah.
it for over 3 years.
Oh, wow.
Yeah.
Wow. Well, and I also find that like if the hospital that they come from is not a stroke certified hospital, it's very likely that they might not get the information that they need. Because
True.
it's not required at those that they have to send them the speech like at a stroke certified
Right.
too. And then I think too, depending on the SLP who's there, if they have a full-time SLP and not just PRNs, the full-time person has to be a big enough advocate to be like, these are the items that need to come through us.
Yes. Yes.
Yeah. Wow. And then dementia. I get a lot of questions about dementia because it's such a common thing.
Mhm.
We don't always hear people talking about that in the media as well, right? We might hear about somebody whose parent or spouse has taken off down the street. But I think that is one that a lot of people are dealing with, but they don't always know exactly what to do, and it is challenging. It can
It
be
is.
challenging.
It is.
Do you tend to get a certain like do you tend to get people at a certain stage in dementia more so in your practice? What are you seeing?
When I get clients who have dementia, a lot of times it is their child that is onboarding them or reaching out for services.
Hmm.
So
Hmm.
it typically is an older person, so 70s, 80s,
Yeah.
sometimes 90s. But those are the kind of the demographic that I see. I do also want to share, in the media, since we're talking about that, the last time I believe that dementia was in the media and it was, big news, was when Wendy Williams, they revealed her diagnosis
You're
of
right. You're
oral
right.
dementia. And then before that, almost immediately before that, it was Bruce Willis. But other than that, we don't really hear about it.
No, no. And even with that, the information is just all wrong.
Wrong, right?
It's so wrong. Yeah. I
Yeah.
was I was glad to see when the Wendy Williams information came out though, like even on my campus, the people in communications were reaching out to they reached out to me to make sure that their information was correct. And I think in some ways people are starting to realize, oh yeah, speech pathologists
Yes.
can help
Yes.
out.
Raise awareness.
So
Yes. I
yeah.
tell people like we have an entire aspect of the field dedicated to being a part of these rehabilitation teams, and
Yeah.
so many people don't know.
Yeah, yeah. And really, I think that's a fault on the profession's part. It's the marketing. We have to market better in a sense because I feel like we kind of we get comfortable in our little silos.
Yes.
I think we have to do better about branching out into other spaces as well because people they don't know.
They don't. I'm
They
on
don't.
this kick this year of be the change I want to see. And
Yeah.
so that is where, going to these different schools comes in, because earlier in my career, I would go and do career days at different
Mm-hmm.
elementary schools and high schools. Sometimes colleges will have something like that where they can just speak to the professional, ask questions, but just sharing about the field. I've even had teachers who are like, how long you got to go to schools? Because they were thinking about switching. So such a wonderful profession. But yeah, you're right. It's a well kept secret. I think the normal buzz of going into, lawyer, doctor,
Mm-hmm.
what are they, firemen, like just the general careers that are out there. There are so many more, so many
Yeah.
more. And unfortunately, a lot of people don't know about our field until they meet us, which is
Yes, that's true. How did you find out about speech pathology?
this is actually kind of funny. I was modeling, I was a model in Atlanta,
Mm-hmm.
and I moved back home to Charlotte, and I was actually online for Delta. And one of my line sisters is a speech language pathologist, and
Okay.
she was saying something, 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 ASHA. I
Mm-hmm.
was like, what is ASHA? She was like, I'm a speech language pathologist. And she was giving me all this information. I know the terms now, but then I was like, oh, okay. And she
Yeah.
said, she was like, look into it. Cause I've always had this thing, like, I want to help people. I want to help people. Early on, it was like, I want to start like a scholarship foundation. Like, I've just always been wanting to help.
Mm-hmm.
And she told me a little bit about what she does. And she was like, look into it, see if you like it. And so she kind of mentored me through my program, my experience. And so it was
Yeah.
an absolute honor to have my mentor on my
Yeah.
committee this year for the topic co-chair for adult swallowing.
Oh, that was your mentor. Okay,
Yeah,
nice. Oh, that is exciting.
right.
That's cool. So I found the profession from a career personality test.
Really? I
Mm-hmm.
think you
Mm-hmm.
mentioned that.
Yeah. I had a friend that was she was in the major, but all she ever said was that she did sign language. And so she was gonna work with people who were deaf and hard of hearing. So I was like, okay, I didn't really know what that meant. I knew I didn't know sign language and I didn't know what I wanted to do. And I took like it was kind of like I don't know, like Myers-Briggs, but for careers. And it was
Yes.
like top three. That was the only way I really found out about what it was. It was
What
like
were
my
the other two? Do you
first
remember?
year of college. Huh?
Do you remember the other
Oh,
two?
I think one of them was audiology. But after I did observation, no shade to the audiologist, but after I did
You love the odds.
I was in the observation, this is undergrad. I was in the observation room, like it was just a lady in there just saying words for like I don't know how long it was. And I was like, yeah, this is not for me. And
I love the odds, but I do ask, like, what do you all do? What do you?
I think the other one might have been nursing, which
So just
makes it
something healthcare,
it was
something
it
helping.
was all because teaching was somewhere up there. I knew I was interested in I knew I liked language, science, and psychology. And I at the time I thought I really wanted to work with children. But then I ended up falling in love with the brain and adults and all that. So yeah,
I never had a pull to the peds.
oh, really? Yeah,
Never
that
did.
was my base. I mean, and I still love them. It's just that I would be so drained at the end of the day.
Yes.
I
I
would be so drained. And I just found neuro to be so exciting.
I like the drive of the adults. So with the
Hmm.
kids, they're not aware of the issue. And so it's just kind of like, I just want what's in the treasure box.
Yeah.
And I love the drive of like my clients who will say like no, like look, like give me a minute. Like I have a client who does not like cues at all. So
Uh,
he has global aphasia, but I had to say like just ask for help when you're ready.
mhm,
So that was
mhm.
one of the things, like, okay, all right, like you can help. But he
Yeah.
doesn't like queuing, but that motivation, I have found that in my adult clients. They want to get better. They like, I used to be able to say this, I want to get
Mhm.
better. And so that drive really helps me because I'm passionate and my drive is there. So I want them to reciprocate and they really do. It just ends up being a beautiful partnership.
Yeah. That's so good. Um, okay, let me see. What else do I want to know? Because I feel like I kind of jumped around a bit. Um, well, let me ask you, as far as like out of all the many things that you do, what is something that you've been the most proud of
Mm. I would say, are we talking professionally?
professionally? But we can say outside of that too.
Okay. Professionally, what I am most proud of, I would have to say my reputation as a therapist.
Mm,
My reputation as a therapist, treating as well as a therapist colleague.
yeah.
Yeah, I very much live by the golden rule, treat people the way you want to be treated. And so I do that for
Hmm.
my clients. When I was in, facilities, my patients, their family members. I mean, my grandmother, she, my maternal grandmother, who I was very, very close to, she ended up having a stroke and she died before I could get to the hospital to see her.
Hmm.
And so I was just thinking about what kind of care that, my aunts and uncles had when they were caring for her and at her bedside. And I just want to be that good for other people because
Hmm.
when I was in grad school, someone said, you're being inserted into someone's crisis. And that just stuck
Yeah.
with me because, you come in and it's like, we have our own agenda. I need to eval you. I got to ask you these questions, but it's like, there's a way that you do it.
Hmm.
You treat them like they're people, you give them that time. So just the compassion and time that I put in with my clients. They say that they can see the passion. They're like, we can tell that you love what you do.
Yeah.
My patients, my clients will be upset when it's time for them to discharge. It's like, you really don't need
Hmm.
me anymore. So I
Hmm.
think that just that makes me feel really good and be proud because it makes me feel like I am doing like what I'm supposed to be doing and I'm doing a good job at it.
Yeah, I love that. I love that because that's the type of therapist we want in
Yeah.
the profession. I always love to describe what we do as heart work. It's heart
Yes.
work. It's hard work, and we work with humans, and we work with humans who are having some challenging times, and they're depending on us to. This is what I tell my students: you gotta read, you gotta know your stuff because they depending on you to help them.
Yes.
Yeah.
Yes.
So,
And I
wow.
think there will be a moment when that clicks because my
Mm-hmm.
moment was at my first CF and patient had been admitted. I was working at a SNF and the PT came down and was like, I'm done with my eval. You can go.
Mm-hmm.
It was my turn, but I'm
Yeah.
asking the PT all these questions and I'm like, what are their side effects? Have they done this? And I'm going through all these things and she's like, I don't know. That's your job. So it's like, oh man, like it's really on me now. I've got to go in there and do these things. And you just kind of you get your rhythm with it. But you have to be good because they're going to be looking at you. You are the expert.
Mm-hmm. Mm-hmm.
Yeah.
That's true. Wow. Oh, well, let me ask you a last question for this language section.
Oh,
Um, I was going to ask you what you really want people to know about acquired brain injury, but I feel like we kind of touched on that. So I guess I'll ask you, what would you really want people to know about speech language pathologists?
I would want them to know all that we do. I would
Mm-hmm.
want them to know the scope because we are such a one-stop shop for so many different like birth to end of life. There are so many different things that we do. And I would just love for us to have just like a list somewhere where we can, I don't know, put it on a shirt or something where people can just see the vast amount of things that we do within our field. I mean, even down
Mm-hmm.
to gender voice affirmation services,
Mm-hmm.
accent modification, voice in general, um,
Mm-hmm.
even the cog stuff. So many people here like, oh, you're a speech therapist. You teach people to talk. You teach little
Yeah.
babies. It's like I am qualified to, but I have specialized in and dedicated time and energy and resources into becoming an expert in on the medical side. So sharing with people that there are different kinds of SLPs, and I will tell people, it's kind of like being a doctor where, you go into a specialty And it's like, there are all kinds of doctors, there are all kinds of speech therapists, but I wouldn't go to, a foot doctor if something happened to my elbow. There
Yeah.
are different kinds of doctors. And so people don't know that about the field. And I think them knowing that there are different kinds would help. And it would also cut down on the calls that I get. I get a lot of calls for peds, and I will have to refer to my fellow private practice owners who work with peds. So I
Yeah.
love helping them in that way. But I like to give even the people who call my office education. And I will say, when you do your search, put pediatric speech therapist so that
Mm-hmm.
your results will be more accurate for what you're looking for. And that little tip really helps. I've had
Mm-hmm.
people give my practice a positive 5-star review just for the way that I took the time to talk to them and help them search. It's like it
Yeah.
doesn't take much and they don't have the
Right.
language. And if it's no big deal, like just share it, raise that
Yeah.
awareness.
Exactly. Exactly. Okay. I lied. One more question.
Okay, okay.
Because this episode is going to air in the month of Concussion Awareness Day.
Yes.
What is something you really, and I know we can go on a soapbox,
I'm
but
excited.
what is at least 1 to 2 things that you really want people to know about concussion or even CTE?
Ooh, okay. One or two?
1 or 2.
Okay, okay.
And then we'll have you come back and we can talk more about
Okay, good. I'm like, this is really hard. Two things, one or two things. I'm going with two. Okay. First, speech language pathologists.
it. Yeah.
I want them to know that because we are the help. That's the big thing. There's no help. Yes, there is. Yes, there is.
Mhm.
So I want them to know about us. And then I guess that's both for concussion and CTE. What I would want them to know about CTE. I would really want them to know the analogy that Dr. Bennett Amalu, the physician who discovered
Mhm.
CTE, said. Can I share the analogy?
Yes,
Okay.
yes.
So he said, imagine a kitchen sink, and
Mhm.
imagine if you take wet cement and you pour it down the pipes. And he said it basically chokes the brain from the inside out in that way. So I add in my little extra piece of detail because I'm a A-type speech therapist. So I got to add in some context for you. But if that cement hardens and if you turn on the water, is any water going to get through the pipes?
Mhm.
No, because it's
Right.
been completely blocked and it gets backed up, and that can cause all kinds of issues. And that
Mhm.
is what happens in the brain. So
Mhm.
the blood flow that needs to get to the parts of the brain, when those parts of the brain are choked off from the necessary blood so that it works how it needs to work, then that's when you start to see atrophy, parts of the brain dying. And if you see those pictures, that's where those dark spots are. I know that you know that. um, but thinking about if you don't have blood going to those parts of your brain that you need to operate,
Mhm.
that is where you start seeing these different symptoms. And so when you
Mhm.
see people who are violent or having outbursts, and you see people who are even arrested or in mugshots, and they're painted as these violent, horrible people, and
Mhm.
the comments that are being said by the people that know them, like, I can't imagine, like, this is not them, X, Y, and
Right.
Z. Instead of labeling them as violent or horrible or a menace or a slack, or just all the negative things, I would like for people to have the knowledge to consider maybe something's happening with their brain.
Right.
Maybe they've played a sport, because we hear all the time, I play ball in college, or I used to play sports when I was a kid,
Mhm.
or guaranteed there wasn't enough knowledge to give them an idea that I could be showing signs of a TBI, concussion, or CTE. So I would want them to know that analogy, and I would want them to know that we are here as speech language pathologists who can absolutely help
Mhm.
in an expert way.
So now we're at one of my favorite parts where I get to learn a little more about you in connection to music.
Okay.
So what you like, what you listen to. Can you tell me a song or even if it's lyrics that motivates you to keep pushing?
Yes, I took notes. I want to get this right. Okay. I actually, when I need like that uplifting to keep me going, I'm going straight to gospel.
Okay.
So my big ones that keep me going are Close by Marvin Sapp.
Oh
So
yeah.
just that encouragement of I must be close because here comes trials and things that
Mhm.
are trying to push me back, but I must be close if that's what's going on. So that helps me like when times are tough, I know that greatness is on the other side and I just have to keep going. And I Understand by Smokey Norfolk.
Oh, you can't go wrong with Marvin or Smokey. Ooh.
Right? Right? So those lyrics of just, yes, I see what you're going through and I understand. I am the Lord, I understand. I see it. And it's just like, okay, he knows what's happening and it's obviously for a reason. So just keep going.
Yeah, I love that. That's good. Okay, so on the other side of that, if you are in that moment and things are really challenging, what is something that lifts you up?
I Need You Now by
Mm-hmm.
Smokey
Mm-hmm.
Norfolk.
That one is becoming a trend in
It
this
is.
section.
Is it?
Yeah, yeah. Smoke people loving smoking.
It's a good
They
one. It's a
eating
good
smoke.
one. Yes. I have two more.
Okay, yeah, give them to
Okay.
us.
Okay. Okay. Also, Thank You for My Life by Smokey.
Yeah, I like that one too.
And then Millions by the Winans.
Oh, yeah.
Yeah, there's a part like right after the intro where it just starts. There's an instrument that plays and it just like does something to my heart where it's just like,
Mm,
oh, yes. Like Millions didn't make it, but I'm one of the ones who did. I'm still here,
yeah.
I'm still alive, I'm still healthy, thank God. And so it just keeps things in perspective. Like there are millions of people who didn't make it,
Hmm.
whatever that may be of not making it.
Yeah.
So it shrinks, whatever I could be upset about or having a hard time with and puts things in
Hmm.
perspective.
Yeah. Because you're seen. He sees
Yes,
you. Good,
absolutely.
good. Okay, what about when you need to relax? Because you're
Mm,
doing a lot of work. So you
yes,
gotta chill.
yes, yes. I set in my self-care time, but
Hmm.
I am a huge lo-fi gal now.
Okay. Okay.
Yes, I
Yeah.
like it because I call it kind of like nothing music.
Hmm.
Because with the other songs, like that's going to distract you. Even last night, I was listening to some of these songs, and it just makes you want to stop and take a moment, and it puts you in a space. But that lo-fi music, I can chart, I can
Hmm.
write for my book, I can get a lot done because I'm not thinking about like the beat or that
The
lyric or that
words.
time that I was in college and that dance or so I can have the nothing time. But if I am going to listen to something with lyrics and it's to relax, gotta be Sade.
Oh, yeah, that she's relaxing.
Yes. Yes.
Good. Tell you a little nerdy part of me. So I like lo-fi. I also like to listen to just like instrumental jazz or
Mm,
just instrumentals. And so the playlist in my phone is called Right Brain.
I love that. Oh, now I gotta take it. Can I share that? I want to
Yes,
use that.
yes. Make a Right Brain
My great
playlist.
playlist. Yes.
Yes. Stimulating it all.
Yes, absolutely.
Yeah. Okay. And so, what about a song that represents you when you are at your best, when you are Kelly?
Okay. When I'm at my best, there are three ladies that I'm going to choose from, and that is either The Voice, which is Whitney Houston,
Okay.
Mariah Carey,
Okay.
or Janet Jackson.
Mm.
They all I just like something that's going to be upbeat. So the song that Janet Jackson sings, Runaway,
Uh-huh.
just that like where you can just like kind of bounce your
Dance a little
shoulders a
beat.
little bit. And yeah, it's just upbeat and happy. Anything that, puts a smile on my face. And those three artists seem to always get that job done.
Yeah, those are some big voices too. Then
Yes.
it's like a silent thunder because she's quiet, but a big voice at the same time. When I was little, I thought I was Janet. I I got to go to her concert, her Rhythm Nation concert
Oh,
twice. Dallas and Fort Worth. I was so hyped. I still have a t-shirt.
Oh, I want to
And
see this t-shirt. That's so
yeah,
cool.
I'll grab it when we get there. But when I was working in Hawaii, she had went on tour and she was coming to Hawaii.
Wait, is that the one with the big, like the big colors and the orange? And she had all those, it
It
was,
might have been like
yes,
2015, I
yes.
think. Okay, so let me tell you what happened. So I had a friend that you had friends at the radio station. She got me tickets. I was gonna get to go sit up close, right? Why was it the day before Asher was starting?
Oh no.
And I had 8 students with posters.
No, you
And I
had.
was like, I hope y'all know that I really love y'all because I have given up going to see Janet.
Oh my, well, I'm glad that that's how the story ended and that it wasn't. They ended up doing fine and I had a great time at the concert. I'm glad you went. Oh, yes. Oh,
Yeah,
wow. See, passion. You love
I
music and
know.
you love the
I know.
profession.
I was like, man.
Yes.
But but it was good because they had an amazing time and I was super proud of them.
Oh,
So
good,
I,
good.
yeah. Okay, so very last thing, do you have any favorite affirmations, scriptures, quotes that you can share that are something that you like read or say to yourself?
Yes. Do what makes you happy.
Mm, yeah.
As an A-type SLP, I'm also a people pleaser. I'm a recovering people pleaser.
Yes.
And so I have to say that to myself because
Mhm.
we can take on so much and, I'll make it work. I'll figure it out. I'll sleep less or like it's always something to take away from myself.
That's
And so
true.
I have to wash all that away. And the first thing I'll ask myself now to prevent myself from being overwhelmed with things that I'm making it work for is what's going to make you happy? What do you want to do?
Mm.
And I start there and then I give my response.
Yeah, that's good. That's good self-care.
Yes. Yes, yes, yes.
Very
Um,
good.
and then scripture, you asked,
If you
yes.
have one.
I keep it right here. It's Jeremiah 29,
Mm-hmm.
11. For I know the plans I have for you,
Mm-hmm.
plans to prosper you and not to harm you,
Yes.
plans to give you hope and a future.
Yes. I have that one in my on my prayer board.
Yes, yes, I keep it right here. And that is another one for going through something. And it's like, it's for a
Yeah.
reason. He has a plan. So you
It
just trust
always
it and keep
is.
going.
It
Yes.
always is.
Yes.
Always, there was a pastor once that said, when you're going through something, God is either trying to discipline you or develop you. But either way, they both support each other if you're open.
Yes. Yes. I mean, I'm conscious about being mindful about what is being done versus being angry about what's being
Mm-hmm.
done. Because it's for a
Mm-hmm.
reason. It's for a
Yeah,
reason.
that's good.
Yeah.
That's good. Well, Dr. Kelly, I have enjoyed this time.
Me too. We always have a good time.
Yes, we'll have to do this again so we can get more into the TBI and all that
Yes,
kind of stuff.
just those two things. It was like, oh, we got
Yes.
more.
Keep the people wanting.
Yeah, there we go. Come on back for more.
So, can you tell people how they can find you?
Yes, yes, absolutely. You can find me on Instagram. My handle is at Dr. Kelly. Excuse me. You can find me on Instagram. My handle is at drkelly.medicalslp. You can also follow at Brain Talk Foundation. And if you are up for it, you can follow at Kensington Academy LLC.
Okay, and I'll also tag Dr. Kelly in the post.
Yes.
All right, thank you so much.
My pleasure. It was an honor to be here. Thank you so much for having me.
Thank you. It's an honor to have you here.